viewers, this is Madiha Masood from NTV Houston. As we all know, the current worldwide outbreak of COVID-19 has left many people with concerns about the spread of this new disease. The latest situation report from WHO points alarming number of cases globally. As the number of infections gets higher, experts from different fields are trying to find ways to help stop the virus from spreading. In our today's show, we will talk how technology can help diagnose of COVID-19. In this perspective, I will introduce you to the technology experts. They are recently launched a dual energy X-ray that could strengthen efforts against the spread of coronavirus. Before we go further, I would like to introduce my guest, K Imaging CTO, Dr. Karim Karim, and CEO Amol A.Karnick. Hello, Dr. Karim. Welcome to my show. How are you doing?
Hi, Madiha. How are you? I'm doing well. How are you?
I'm good. Let's welcome Amol A.Karnick, the CEO. Amol, welcome to my show.
Great. Thank you very much, and thank you for having us.
My first question is for Dr. Karim. Dr. Karim, can you please tell us about K Imaging and how particularly Reveal's technology can help diagnose of COVID-19?
Okay, so K Imaging is a startup company. It came out of the University of Waterloo based on some technology developed at the university over the past 10 years. And one of the products that K Imaging has created is called the Reveal Mobile Dual Energy X-ray Detector. Now, what makes this detector so unique is that it is the only detector in the world that is portable and can perform dual energy X-ray imaging. Now, dual energy X-ray imaging is a type of imaging where two energy X-rays are taken, a low energy and a high energy. And this allows us to subtract features inside the human chest radiograph. For example, we can take the bones out of the picture so we can visualize the lungs very clearly. And for COVID-19 and pneumonia, if you want to look at this disease carefully and you don't want to miss it, you want to be able to see the lungs very clearly. So this feature of dual energy, the ability to take the bones out of the chest X-ray, is very important for COVID.
Amol, how would you explain how is your technology different from a regular X-ray?
Great. Thank you for the question. So to distinguish between our X-ray and current X-ray, today X-ray, what you've probably had an X-ray before, you've seen what an X-ray image looks like. X-ray today really focuses at looking at the bone images, what you can see in the bone structures. So if you had that's why it's great for fractures. You can look at the rib cage. Where we differentiate between today's X-ray and what we call, say, even color X-ray. The reason we call it color X-ray, like Karim was saying, our dual energy X-ray, in our X-ray detector, we actually have the capability of separating three energies, which is different than the current X-ray that only looks at the black and white images. But the three energies, like your eye, can see three different colors and create this amazing color world we see. We have three different energy buckets in our X-ray detector to help better visualize the anatomy of the body. Such as, when you look at the chest wall, you have the rib cage surrounding the lungs. And with our technology, we can actually remove the rib cage and only look at the lungs and focus on that soft tissue. And if you look at something like coronavirus or even TB or lung cancer, sometimes the rib cage gets in the way of actually seeing the lungs well. And our technology allows you to remove that rib cage and look at only the lungs to help better identify the disease that you're looking for.
Okay. Dr. Karim, my question is for you. I was reading that dual energy X-ray is something that already exists in the market. How is K Imaging's detector is different?
Yeah, absolutely. That's a very good question. So dual energy X-ray has been around for maybe 30, 35 years. It's not actually a new technology. In fact, it was developed in the early 70s by scientists, and then Fujifilm made a detector out of it, and then some of the American companies also picked up on it, and they started to make dual energies. But for all of these systems, the way they do dual energy is very different. So now, if you look at existing dual energy systems, they actually take two X-rays, okay? They take a low energy X-ray, and then they take a high energy X-ray. So think about this. If I have to take two x-rays, I can ask you to hold your breath, but your heart is going to continue to beat. And that's where the real problem sits. Because when I take two x-rays back to back, your beating heart causes these unsightly streaks in the image. The image doesn't look very good. Sometimes those streaks can even lead you to think that there's a problem when there isn't a problem, or where there is a problem when there isn't a problem. You see what I mean with so that's the main problem with existing dual energy technology. Now, what we've done at KA Imaging is we've changed that completely. In our technology, we actually acquire 3 images simultaneously. So our technology can capture 3 different X-ray spectra or X-ray energies in one exposure. And that is a huge advantage, because when you're talking about a portable or mobile X-ray, like if you think about it, COVID infection, it's very infectious, first of all. So if a patient who has this infection is put into a room, you have to spend a lot of time to clean that room before somebody else can come into it. Okay? It's much easier if that patient is in a ward for COVID patients and a mobile machine is taken to the patient in order to image them. So what we've done is create this with our technology. Because we can acquire all 3 images simultaneously, we can make our machine portable. And we can take this machine to the patient in the ICU, in the screening center, even to homes if necessary. It's that portable. And that's what differentiates us from all the other dual energy out there. We are the world's first and the world's only portable dual energy X-ray detector.
I would say credible. Amol, when you say motion artifact free, what does it mean? Pardon my ignorance on that. And why is this so important?
Great, thank you for the question. So as Dr. Karim was explaining a little earlier, our technology differs than, say, current dual energy in that it's a single exposure. Today, dual energy uses 2 exposures. They're separated, one at a slightly higher exposure level, one at a slightly lower exposure level. Now, between these exposure levels, there's always a slight time gap. That time gap may be relatively fast, half second, quarter second. However, you as a person, me as a person, our heart is always beating. So we can ask you to hold your breath, but not stop your heart. So the beating heart for today's dual energy creates a motion artifact. And that motion artifact has actually been shown sometimes to create a false, they tell that fact from a potential nodule or a disease that they're looking for. Whereas our technology, with one exposure, captures all the information necessary to do this energy separation and looking at the lungs or the soft tissue separately. And so that's what we mean by motion artifact free. Without any motion, because there's one exposure, we can have more confidence in the diagnostics on the imaging that we're providing.
Okay. Dr. Karim, have you ever tried the detector in a real medical environment?
No, absolutely. That's a fantastic question, Madiha. So yes, we have. So last year, we started a clinical trial in Canada at Grand River Hospital, which is located in Kitchener. Kitchener is about 1 hour away from Toronto.
Okay.
And we ran this trial on patients who either had lung cancer or were suspected of having lung cancer. And so they were coming to the hospital for a follow-up CT scan. Okay, so as they came for the CT scan, we asked them if they would like to help with dual energy technology, and we took a dual energy X-ray along with their CT scan. And then we looked at the data from the dual energy X-ray and the CT scan. Now, this trial is still continuing. We've had about 22 patients go through it. There's still a few more to do, but preliminary results are very promising. The radiologists that have looked at the images are very impressed by the quality and how we've been able to pick up on lung cancer as well as lung nodules. So one of the things that actually brings up a very important point. one of the things that I was going to say is that dual energy is very good at separating materials. So you're able to separate soft tissue and you're able to separate bone. But if you ask yourself, what is the main component of bone? Actually, the biggest component of bone is calcium. So we can separate anything in the body that has calcium in that bone image. We can see that. Now, it turns out when you look at lung cancer, you get masses in the body, in the lung cavity, and some of those masses are soft tissue, and that makes them dangerous. They could be malignant in cancer, but some of them are calcified, and that makes them a little bit less dangerous. They're essentially benign. So with our dual energy, we were able to identify which of the masses are calcified and which ones are not calcified. And that was a very nice feature in the trial where we showed the ability to view the lungs without the bones obscuring it. So very nice picture of the lungs. But then we also saw the bones without any lungs there. So again, a very nice picture of the bones. But at the same time, we could identify the calcified nodules. And that's, of course, a very prominent feature of dual energy, and this was part of the trial.
Okay. Amol, so you are trying for lungs cancer, but how can this technology be beneficial during the COVID-19 crisis?
Oh, absolutely. I'll be happy to explain that. So as Karim had earlier mentioned, we've already imaged about 22 patients in this lung cancer trial. Some of the anomalies that they see with lung cancer is pneumonia and another ground glass opacity. These are two anomalies today that they're looking for with COVID-19 patients. These patients will present with either some ground glass opacities or a bilateral pneumonia. And since we actually have patients who've had these two anomalies identified in the lung cancer trial, we've got the confidence that we can actually help with the COVID-19. So as you may have been reading in the reports as well, that CT is being used to look for these two anomalies, both the ammonias and the ground glass opacities. And we feel that CT is not the best for screening here. Mm-hmm. And as we've talked to some sites, when they have a CT, they have to take an hour to clean the system so that, the next patient may not get infected if they're a suspect of COVID-19. Mobile X-ray has been being used widely because it can actually go to the COVID wards. But the challenge is they have trouble seeing these ground glass opacities and sometimes ammonia with standard chest X-ray. And that's where our technology can really help by eliminating the rib cage and seeing these bilateral pneumonias and ground glass opacities and visualizing them better than you can with current X-ray. We feel that we can help identify patients that may be suspect COVID-19 or positive cases, and also helping for future where we can help with the assessing the patient to see if they need to be put on ventilators or to see how well they're reacting to drugs and seeing how their lung health is either improving or getting worse.
Okay. Karim, why are some distinguished institutions such as the American College of Radiology discouraging the usage of CT as a first-line screening method for COVID-19? How would you explain this?
Yeah, absolutely. So that's also a very important question, very important to understand why CT is being discouraged. The main challenge today has to do with radiology rooms. If you look at a fixed room, the ventilation in that room is not the best. And because the ventilation is poor, when a patient walks in who has COVID infection, there's a very high chance that the operator of the machine could get the infection or the next person walking in could get the infection. You really don't want to be putting an infectious patient into a room where the airflow is not designed for that purpose. So that's why fixed X-ray rooms, fixed CT rooms, those are completely discouraged, not only by the American College of Radiology, but also the CDC, the Europeans, and even the Canadian Association for Radiology. They have all said, stay away from fixed rooms for exactly that reason. And that's the reason why right now, all the hospitals have become so reliant on mobile technology that can be taken to the patient, into a COVID ward, into the ICU, where the patient is, because you cannot take a fixed CT in where the patients are who have COVID, right? So that's the reason why all these esteemed agencies have been recommending away from using that type of imaging.
Okay. Amol, have you clinically tried Reveal for COVID-19 purposes?
No, we haven't tried it yet. However, we are about to start 2 trials that are directed at imaging COVID-19 patients. One's here in Canada and one is down in the US as well. We have several other sites around the world as well that we are now engaging right now to ensure that we can gather some more data around the COVID-19.
Okay.
And
Karim,
ensure that,
okay.
Sorry, go ahead.
Karim, how long have you been researching this technology?
So technology researchers in general takes a very long time, right? It's a very slow moving process. So I started working in X-ray imaging in 1998. And this particular technology, the early versions of it, we started to look at it in 2007, 2008. And then over the years, in 2013, Amol and I started up the company. And then in 2016, it got a little bit intense where we finally took the technology from its research phase into its commercial phase. So I would say for this technology, more than 10 years.
10 years, a big time. What are your next steps? Any of you can share your ideas or both. Amol, you first.
Sure, absolutely. So for us, we're very encouraged about trying to get our detector and technology out into the marketplace. And so for us, we'll be applying for the FDA. So for those, we need to make sure we get the regulatory clearances to be able to use it officially in patients. And we'll be applying for those regulatory clearances in the next month and a half. And so that's our primary goal right now, is to be able to deploy our X-ray technology to help people and help in this current crisis. But beyond that, making sure we address the lung cancer, the TB patients, and making sure that we can help with better diagnostics in the future.
Okay, Dr. Karim, your comment.
Absolutely. As Amol said, our goal is right now to get through the regulatory process, both in the US and Canada. But more importantly, we also want to get trial data. Because as you know, right now, COVID infections are starting to hit a peak. There's a lot of data out there. It's very tragic, of course, that people are getting hurt. But at the same time, the clinical trials will allow us to get the data that we need so that if something like this happens in the future, we're ready for it. We have the technology. We can create artificial intelligence algorithms. We can create diagnostics. We can create systems that are ready in place, mobile, so that hospitals can handle infectious type of outbreaks in the future in a much better way than we've been able to so far.
Okay, on behalf of NTV Houston, I thank you both for your precious time. Hope Reveal technology will help diagnose COVID-19. Thank you very much again. As we all know, COVID-19 cases continue climbing globally. We salute to our medical doctors, nurses, paramedical personnel, scientists who are working day and night with their untiring efforts. Technologists are trying their best to cope up the situation more fast. We wish all the very best to the experts and the citizens for their success against the invisible killer, coronavirus. That's all from now. Thank you for watching NTV Houston. For more updates, follow us on Facebook and Twitter. Thank you very much again.